Welcome. I'm Dr. Douglas Wingate, Integrative Neurorehabilitation Specialist and Neurogen Brain Balancing Practitioner. Here I want to address one of the most prevalent and underserved conditions in neurorehabilitation, traumatic brain injury, including concussion and post-concussive syndrome. For too long, the standard message patients have received after a brain injury is to wait, rest, and hope for the best. Neurogen brain balancing offers something far more active, a targeted, evidence-informed, drug-free approach to supporting genuine neurological recovery. Helping people heal from traumatic brain injury has been the focus of my clinical practice since I started in 2011. There are many tools and therapies that I use to help people on that path, and one that I have found particularly powerful is neurogen brain balancing, which I want to talk about. But before we talk about the treatment, it helps to understand the spectrum of brain trauma, because terminology matters both for patients understanding their diagnosis and for providers making referral decisions. The term MTBI, or mild traumatic brain injury, is the medical term for a concussion. The word mild refers to the mechanism, not the impact on a person's life, and that distinction is important. Traumatic brain injury as a broader category encompasses moderate and severe injuries from external force. Post-concussive syndrome, or PCS, describes persistent symptoms that continue for weeks, months, or even years after the initial injury. And this is where many patients find themselves most lost. CTE is the progressive neurodegenerative associated with repeated head impacts, most discussed in the context of contact sports. Diffuse axonal injury refers to the shearing of nerve fibers from rotational forces, effects that are often entirely invisible on standard MRIs, but measurable with MEG imaging. And blast injuries, the shock wave from explosive forces, is the signature TBI mechanism of modern combat. Understanding which type of injury we're dealing with shapes how we approach treatment and how Neurogen fits into the recovery plan. The scale of brain injury in this country is staggering, and it rarely gets the public attention that it deserves, which is why it's been called the silent epidemic. More than 2 million Americans sustain brain injuries every year. Approximately 4.5 million are currently living with residual effects, managing ongoing disability from injuries they've already sustained. The lifetime economic cost for people who have been injured in 2000 alone was estimated at $76 billion, with an additional $137 billion in estimated quality of life loss. These numbers represent an enormous population of patients who are still symptomatic, still searching for effective treatments, and too often being told that there's nothing more that can be done. That is exactly the gap that Neurogen was built to address. TBI is not simply a bruise on the brain. It disrupts the brain's electrical activity, structural connectivity, and inflammatory balance, often in ways that standard imaging can't even detect. Four key mechanisms are particularly relevant. First, there's abnormal slow wave activity. MEG and qualitative EEG imaging have shown pathological slow wave generation of the amygdala, hippocampus, and the prefrontal cortex, which is directly correlated with cognitive and emotional dysfunction. This is the measurable neurological signature of TBI that conventional MRI frequently misses entirely. Secondly, diffuse axonal injury. The shearing of axonal connections from rotational forces disrupts communication between different brain areas. And third, neuroinflammation. Glial cell activation and cytokine release create chronic inflammatory states that worsen cognitive impairment and actively slow neurological recovery. And fourth, autonomic nervous system dysregulation. The autonomic nervous system loses its regulatory balance, contributing to sleep disruption, persistent headaches, emotional dysregulation, and chronic pain. Effective treatment needs to address all of these mechanisms, not just manage surface level symptoms. Post-concussive syndrome is what we're most commonly treating in the clinical setting. The person who has had a concussion 6 months ago, a year ago, sometimes 5 years ago, and still isn't feeling right. PCS impacts three broad domains. Cognitively, there can be brain fog, difficulty with concentration, impaired memory, slowed processing speed, and executive function deficits that affect work, school, and daily decision making. Physically, chronic headaches and migraines, dizziness and balance problems, profound fatigue, sleep disruption, and sensitivity to light and noise that can make ordinary environments unbearable. And also emotionally, irritability and mood instabilities, anxiety, depression, emotional dysregulation, and in up to 44% of cases, the full clinical picture of PTSD. PCS is not a psychological condition, it is a neurological condition, and it needs to be treated as one. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. 4 features make it particularly suited to TBI. First, the passive protocol. There's no active tasks, there's no screens, no effort is required. The injured brain doesn't need to perform anything, it simply receives. This is uniquely suited to TBI patients with cognitive fatigue or attentional impairments that make active therapies difficult to tolerate. Second, real-time EEG guidance. Live brainwave data is analyzed every session to identify current dysregulation, and the protocol is generated fresh, minute to minute, directly targeting where the brain is struggling right now. Third, lip test microcurrent signaling. Low intensity pulse transcranial electrical stimulation delivers a gentle reference signal that supports the brain's own self-regulatory processes without pharmaceuticals or invasive interventions. And fourth, neuroplasticity activation. By targeting maladaptive slow wave patterns, Neurogen supports the brain's ability to reorganize itself, enhancing synaptic efficiency and promoting restoration of functional connectivity. And here we get to the clinical core, which is worth slowing down here for providers in particular. Each mechanism of TBI brain disruption has a direct neurogen response. The abnormal slow wave activity that MEG reveals in TBI is addressed through lip tests, which has been shown in studies to significantly reduce pathological slow wave generation in TBI-affected brain areas. Diffuse axonal disconnection is addressed by supporting restoration of functional connectivity through neuroplasticity promotion and synaptic reorganization. Chronic neuroinflammation is thought to improve through Neurogen's influence on microglial activation and cytokine expression, mitigating the neurotoxic effects of prolonged inflammation. And dysregulation of the autonomic nervous system responds to vagal nerve modulation effects, shifting the autonomic balance toward parasympathetic dominance. Sleep disruption improves as the autonomic nervous system rebalances and restores deeper sleep cycles, which is itself critical for neurological recovery since the brain's lymphatic clearance system operates primarily through deep sleep. And cognitive and emotional fog are addressed through EEG-guided protocols targeting the prefrontal subcortical disconnection patterns that underlie executive function. The anchor study here is Fong et al. In 2017 MEG pilot study published in Brain Injury. 6 patients with mild traumatic brain injury and persistent post-concussive syndromes were treated twice weekly for 6 weeks with Neurogen. MEG exams were conducted at baseline and at follow-up, and the results were striking. All 6 participants showed abnormal slow wave signals at baseline. Following treatment, MEG showed significantly reduced abnormal slow waves in the same brain areas, and those reductions strongly correlated with significant reductions in post-concussive symptom scores. Strong TBI candidates for Neurogen include patients with concussion or mild traumatic brain injury, whether it's acute or with persistent post-concussion syndrome. Moderate to severe TBI patients in the rehabilitation phase are also good candidates. Sports-related concussion is a natural fit, as are blast injuries from military or occupational exposures. TBI patients with comorbid PTSD, anxiety, or depression, which is a significant portion of the TBI population, benefit from Neurogen's ability to address those co-occurring patterns at the same time. Patients whose cognitive fatigue has limited their ability to engage in active therapies are especially good candidates for the passive approach that Neurogen offers. And anyone seeking drug-free adjunctive support to complement their existing brain recovery program belongs in the conversation. The contraindications are narrow. Active uncontrolled seizure disorder requires consultation before starting. Implanted electrical devices need individual review, and Neurogen is not a substitute for neurological evaluation or standard of care. It works best as a complement to occupational therapy, speech therapy, physiatry, and neurorehabilitation programs. It's not a replacement for any of them. The brain can heal. That is not wishful thinking. That is the fundamental principle of neuroplasticity, and it's supported by the imaging evidence that we talked about. For those living with the effects of TBI, concussion, or post-concussive syndrome, many of whom have been told that there's nothing more that can be done, Neurogen brain balancing offers a safe, evidence-informed, drug-free path towards genuine neurological recovery. To learn more about our integrative neurorehabilitation practice and to schedule a consultation, visit acuneuromodulation.com. For veterans specifically, our bb4vets.org program affiliation offers U.S. military veterans 4 free Neurogen sessions. We're ready to help, and thank you for your time.